Today, all of us stand before you and proudly proclaim our belief that health care in America must be a right, not a privilege. Today, we begin the long and difficult struggle to end the international disgrace of the United States, our great nation, being the only major country on earth not to guarantee health care to all of our people. As proud Americans, our job is to lead the world on health care, not to be woefully behind every other major country. Today, we begin the debate vital to the future of our economy as to why it is that in the United States, we spend almost twice as much per capita on healthcare as any other nation on earth, and yet we have 28 million people without any health insurance, and even more who are underinsured with high deductibles and copayments. As a result of the incredible waste, bureaucracy, and profiteering in our dysfunctional healthcare system, we are now spending nearly 18% of our GDP on healthcare, $10,000 per person. Incredibly, if we continue the status quo, we will spend an estimated $49 trillion over the next decade on healthcare. That is economically unsustainable for our country. Today, we say the function of a rational healthcare system is to provide quality care to all in a cost-effective way, and not to continue a system which allows insurance companies and drug companies to make hundreds of billions of dollars in profits each year, and to make healthcare industry CEOs extremely wealthy. Further, as you've heard this afternoon, the function of a good healthcare system is to enable people to get the healthcare when they need that healthcare, not to deal with an endless amount of paperwork and to spend hour after hour arguing with insurance companies about whether or not you have the coverage for the procedures that you need. The strengths of a Medicare for All program are not only its universality and its cost effectiveness, it also ends the complexity of a system which adds enormous stress at a time when people need it the least. And today we say to those families in Vermont and in Wisconsin and California and all across this country who are spending $10,000, $15,000, $20,000 a year on health insurance, that we understand that this is insane and unaffordable to be spending that much money simply to protect the well-being of your family. And we're here to tell those families and people all across this country that under Medicare for All, the average American family will be much better off financially than under the current system, because you will no longer be writing checks to private insurance companies. While, depending on your income, your taxes may go up to pay for this publicly funded program, that expense will be more than offset by the money you are saving by the elimination of private insurance costs. And today, we tell the drug companies that the American people are sick and tired of the greed of the pharmaceutical industry. We are no longer going to get ripped off and pay the highest prices in the world for prescription drugs under Medicare for All. We're going to negotiate lower drug prices for the government and for every single American. And today we tell the business community, especially small and medium-sized businesses, that we understand that you want to focus on your core business mission, not to spend countless hours worrying about how you will provide health insurance to your workers. And Medicare for All will allow you to do that, because all of your employees, by right, will have comprehensive health care. And today we say to millions of workers that you should not have to be stuck in a job that you don't want just because it provides decent health care to your family. With health care as a right, you will finally have the freedom to do the work you love and are passionate about, and our economy and our nation will benefit from that. 52 years ago, President Lyndon Johnson signed historic legislation that said in the United States of America, if you are 65 or older, you will be guaranteed health care as a right. And that legislation, called Medicare, has been enormously successful. We take it for granted now, but seniors in America are healthier, happier, and more secure than before the passage of Medicare. And today we tell our seniors that as good as Medicare is, we have heard your concerns, and for the first time, we will expand coverage to include dental care, hearing aids, and vision needs. Now let us be honest. The crisis we are discussing today is not really about healthcare. Crisis we are discussing today is a political crisis which speaks to the incredible power of the insurance companies, the drug companies, and all those who make billions of dollars off of the current system. Over the years, these entities have done everything that they possibly can to prevent us from having lower-priced prescription drugs and universal health care. As one example, hear this. Since 1998, the pharmaceutical industry alone has spent over $3.6 billion in lobbying and hundreds of millions of dollars more in campaign contributions. And they charge us the highest prices in the world for prescription drugs. Now, I fully recognize that legislation which deals with 1/6 of our economy and over $3 trillion is complex, and that nobody, including those of us who are up here now, have all the answers. Unlike the Republican leadership, which tried to pass massive and destructive health care legislation without one public hearing, our job now is to take this legislation to every state in the country and to hear what the people have to say. Unlike the Republican leadership, we want to hear from doctors and hospitals and patient advocates and ordinary citizens as to how we can make this bill even stronger and more effective. We want to hear from the American people as to the fairest ways that we can fund this program. But to my Republican colleagues, please don't lecture us on health care. In the last few months, you, the Republican Party, have shown the American people what you stand for when you voted for legislation that would throw up to 32 million Americans off of the health insurance they have, and at the same time give huge tax breaks to the rich and large corporations. You, the Republican Party, have no credibility on the issue of health care. Let me conclude by telling you that I am extremely proud that we now have the support here in the Senate of 16 senators plus myself and a whole lot of folks in the House of Representatives. And importantly, we also have the strong support of dozens and dozens of grassroots organizations and trade unions representing the working people of this country. They know, as we know, that this struggle will ultimately not be won here on Capitol Hill, but through the grassroots activism of millions of Americans who are standing up and fighting back, who are becoming more engaged politically. And when we all stand together, we're going to be able to take on the insurance companies and the drug companies and Wall Street and everybody else, and to do what we should have done decades ago, and finally guarantee health care to all Americans as a right. Thank you very much.